Now let's look at the technique factors for actually giving this injection. The needle pathway, the angle at which the needle is going to enter the tissue, is really important in the PSA. So we already talked about the mid-sagittal plane and the horizontal plane of the occlusal surfaces, which I'm going to actually do in this direction. So I'm still horizontal to the plane, occlusal plane, okay? So what we're going to do is we're going to do 45 degrees to the occlusal plane. So this is the occlusal plane. We're going to come down at 45 degrees to the occlusal plane. Okay, so we're coming from here and we're coming down 45 degrees. Then we need to be 45 degrees to that mid-sagittal plane. Okay, so we're going to come out. All right, because our mid-sagittal plane is this way, we're coming out 45 degrees to the mid-sagittal plane. Okay, so we started here, we're going 45 degrees down from the occlusal plane, and we're going to come out to the side 45 degrees from the mid-sagittal plane. This is the angle at which we're going to give that injection, and we're going to be down and out. Okay, we're going to be down 45 and out 45. And this is going to bring us right back up into that void. So we're going to be posterior to that zygomatic process up into that void. And that's where the injection is going to be given. So let's look at that with the syringe. So what I do is I come and kind of look at my patient like this. Okay, so I'm going to be down, so that's 45 degrees to the occlusal plane, and I'm going to be out 45 degrees to that mid-sagittal plane, and my injection is going up into this area. And if you look at your skull, that's a good way to do it. Get your skull out, use a pen or something, and you're coming up into that void. Okay, so you're behind or posterior to that zygomatic process. You're not hitting that, we're going behind it. And that's why we're looking at the distal of that second molar. And we're going to talk a little bit more about how are we going to find that exactly in the mouth. But what you're going to notice is that void back there, that's where there's a plexus of veins, and it's very soft in there. If you palpate in your own mouth and go way up behind that zygomatic process, there's a void there. It's very soft and squishy, for lack of another word, and you can palpate that in your own mouth and see where it is. And when you palpate that, it actually is pretty sensitive up in there because of the plexus of veins and nerves that you're pushing on.